Assalamu alaikum. Welcome to 24/7 with me, Nausher Khan. This is the third part in the series profiling the role of NGOs in local community development. We are standing in the middle of old Karachi and downtown Karachi, an area that most Karachiites only speed through because of the highly publicized image of it being violent and lawless. But behind me stands the Burhani Hospital as a beacon of hope and prosperity amongst the otherwise dilapidated infrastructure of the neighborhood. Standing next to me is Dr. Munir Ahmed. Hi doctor, how are you?
Hello Nausher. Assalamualaikum. I'm Dr. Munir, Burhani Hospital Trust CEO and the Chief of Operations.
He is the CEO of operations of the entire hospital, and hopefully he can give us a brief history of how old this infrastructure is and the projected growth pattern of the hospital.
Nausher, this is a 100 years old building. 100 years old. 100 years old. Actually, it was developed as a small-time dispensary to counter the influenza effect of 1913. When there was epidemic in Karachi, the whole Karachi was suffering. So some philanthropic people came with the idea to have a dispensary over here. Later it was upgraded to maternity home, and in 1978 it was converted into full-fledged hospital of all multi-disciplinary medical sciences.
Okay. So it has been operating for about 32 years as a full hospital.
As a general hospital.
And hopes to operate for many, many more years.
Inshallah, until the world is there, and we'll keep on treating and helping people, serving people.
Inshallah. So doctor, with the aid of Dr. Munir Ahmed, we can hopefully take a tour around the hospital and see exactly what services this hospital provides and to the type of people it provides it to. So doctor, shall we go?
Welcome. Please follow.
We are here at the ground floor of the Burhani Hospital, where we can see the entire outpatient department is dedicated to the ground floor. In the sense that on our left is the emergency room, which operates 24 hours to any patients that need it. On our right is the pharmacy, which dispenses pharmaceutical drugs at the cost that the hospital purchases them. Okay? Then there is the reception, and as we move along further, there is the inpatient counter, where all the people who are being admitted for a longer period of time are checked in. Okay. On our left is the orthopedic OPD, where all the orthopedic consultations take place, and further along is the laboratory, where all the blood work and all the phlebotomists house themselves and do most of their work. As we move further along, you can see further along that there is an X-ray department. Doctor?
Yeah, there's an X-ray department. On the left side is laboratory, which can cater for all type of laboratory investigations, blood, urine, tools and all sort of microbiology, hematology.
It is a fully operational hospital with all sorts of facilities. Arguably, approaching us is the X-ray department aforementioned, जहाँ आप सारे X-rays कर सकते हैं.
हम सारे X-rays कर सकते हैं. हमारे पास बड़ी सी मशीन है. हम IVPs वगैरह करते हैं. सारे orthopedics के X-ray करते हैं. Kidneys के X-rays करते हैं.
So as we walk along and past the X-ray department, we are approaching the elevators. These are elevators for the patient?
Yeah, these are elevators which link both the blocks, new and old block. I mean, which is a linkage between a century.
Currently, we are in the old block of the Burhani Hospital. Saying that there is an old block implies that there is a new block. Abhi, we will further discuss the three-phase development, I believe, that Burhani Hospital Trust has initiated.
Exactly. Burhani Hospital is managed by Burhani Hospital Trust, which took over the management of the hospital in 2005. They had a vision to create a facility which is at par with any modern hospital of the Karachi or of Pakistan for that matter. And keeping that in mind, under the guidance of Sayyidina Burhanuddin, we initiated the three-phase program. Program was three-phase. Phase one is complete, and we have inaugurated 4 months ago, and I'll be showing you, taking to the program.
Perfect.
Where we have shifted our inpatient departments. In phase two, we'll be developing diagnostic and outpatient department.
Perfect.
While in third phase is a little ahead of our project, we'll be developing specialized medical units like cardiology, oncology, neurology, nephrology, etc.
So for all the viewers out there, inpatient department means any patients that need to stay here for a prolonged period of time, that need extensive medical attention and care. So as you can see, and we will further see, that this hospital, despite being in the heart of old Karachi and having downtown in its proximity, is comparable to any other leading hospital out there. Despite the location, it provides as qualitable a service as anything else. So, Challenge, Dr. Saab, we shall take a look at the place. Perfect. We are standing outside of the phase 1 development, jo aap pehle bata rahe the, about the 3-phase development. We are standing literally out of the completion of the phase 1 development, which, as the viewers can see, is a multi-story building where I believe your entire new facilities are housed.
Exactly. Nausher, we are in passage which leads us to the phase 1. Phase 1 consists of 91 inpatient beds, comprising all types of general wards, private wards, semi-private wards, and the labor rooms, the maternity ward, the peds wards, and ICU, with all allied facilities, and of course 3 state-of-art surgical units, surgical operating rooms, with all associated facilities like the sterilization and the recovery rooms, the step-downs, and all those things.
Okay, perfect. So as Dr. Munir here explained, it is a comprehensive facility that any local community members or any people in need, from whether they be from Karachi, Lahore, any economic or social strata, can take advantage of. So Dr. Munir, shall we go upstairs and take a look?
Nausher, please welcome to our new block. There's a 4 upper floors of the building, which is actually 8-story building. And we have landed on the 5th floor. Okay. 5th floor consists of 3 state-of-art operation theaters and 8-bed ICU with all allied facilities.
Perfect. So let's go have a look and see what facilities the 5th floor houses. The first thing, doctor, that seems to absolutely just hit you as soon as you leave the elevator is that this floor, or at least the waiting room, seems to be centrally air conditioned.
Yeah, it was felt especially during the hot and humid day. This floor is completely air conditioned, centrally air conditioned. All the reception areas of all floors are air conditioned. So to provide the comfort to all people who are waiting, already in pain, waiting for their patients, they should be,
quite comfortable. Is this a facility common to all the floors?
Yeah, this is a common facility, all the floors and all reception areas.
So doctor, where are we going right now?
We are entering into the theaters area. When we'll go inside, on our right side will be ICU, and on left side will be surgical complex.
Perfect. हम खड़े हैं इंटेंसिव केयर यूनिट के सामने. डॉक्टर अंदर जाके देखते हैं फिर क्या.
प्लीज आइए, बड़ा क्रिटिकल एरिया है हमारा.
Doctor, सुना है कि there is a rather unusual sterilization procedure that we have to take.
Critical areas सारे sterilized होते हैं, and we have to take extra measures. That's why we have to stop here and change our shoes.
So doctor, as we enter, hopefully you can tell us a little bit कि यहाँ कितने beds हैं और कौन सी operational facilities available हैं.
Critical area consists of 8-bed facility with allied facilities as ventilators, the central monitoring, the central oxygen supplies, the resuscitations, all equipment like defibrillators and things.
और यहाँ 24-hour monitoring
24 hours monitoring हो रही है. All the activities monitored on this central. All beds are monitored on central station.
अच्छा.
Dr. Harish is our critical care specialist, and Dr. Amit is another doctor who looks after the patients in the ICU.
As you can see that there are 2 patients right now in the intensive care unit, and they both seem to be in critical condition.
Yeah, this patient is suffering from chronic liver disease, which is most of the time irreversible disease, and we are hoping for his early recovery.
Inshallah.
And he is in critical condition, inshallah. While this patient has been brought with acute renal failure, and hopefully, inshallah, he'll recover.
Inshallah. But this facility stands, as previously mentioned, as a beacon of hope for anybody in need of severe medical attention, and there is nobody in need of more medical attention than the people in the intensive care unit.
Yes, sir.
So as everybody can see, the viewers out there can see that the facilities here are top shelf. So there is no, disparity amongst any of the hospitals, and especially this one. It provides the utmost best facilities at the cheapest possible cost.
That's correct.
Doctor, now that we have covered a comprehensive footage of the 5th floor, let's take a trip to the 6th floor.
Yeah, I'll take you to the 6th. Go to the